Okay, so we're going to demonstrate the special tests for lateral epicondylalgia. The first test is called a Cozen test. Step 1, have the patient extend the arm. Step 2, have the patient make a fist. Go ahead and make a fist. Right? Naturally with that fist, they'll go into slight extension. You can put them in slight radial deviation just to further bias the test towards the extensor carpi radialis brevis. Step 3, I'm going to take my stabilizing hand and I'm going to support the elbow with my thumb resting, I'm just going to show you this, resting just off where, just on where that common wrist extensor tendon attaches to the lateral epicondyle. So pretty much my thumb is kind of overlapping the origin of the common wrist extensors and the lateral epicondyle. Thumb there. Then what I'm going to do is place my hand on the back of her hand. I'm going to tell her, if this hurts, please let me know, and gradually begin to build up my resistance for about 6 to 10 seconds. 1, 2, 3. Let's say she says, ouch, that hurts. Is that the same elbow pain that you've been experiencing?
Yes.
Okay. The positive result is concordant reproduction of symptoms at the lateral elbow. That is a Cosine test. Cozen test. Now, same initial steps to do a Maudley test. The only difference is instead of extending the wrist, I'm going to have the wrist in neutral and the fingers straight out in an extended position. My thumb is still right over that lateral epicondyle. Okay. What I'm going to come and do is I'm going to apply pressure down on the third digit. Okay. Just gradually build up my pressure. I don't want to be aggressive because this is a little finger and it doesn't take a lot of resistance. Gradually build it up to 6 to 10 seconds as needed, and a positive result is a reproduction of pain at the lateral epicondyle. Remember, this is a test that specifically biases the ECRB, which inserts onto the base of the third metacarpal. Last test for lateral epicondylalgia, we're going to do what's called a Mills test, which is basically just passive wrist flexion. Same starting position, elbow's got to be extended. Your hand is supporting the elbow with your thumb gently resting on the lateral epicondyle. All you're going to do is passively flex the wrist until you get tissue resistance. A positive test is a reproduction of concordant pain at the lateral elbow. You can further sensitize the test if you do not get a positive result by curling the fingers down and then repeating the test to see if that brings out the concordant reproduction of symptoms. Understand that the reason I ask you to do it without curling the fingers in first is that way the long finger extensors do not limit your range of motion into wrist flexion and thus potentially mask the ECRB. Come back, do it again if without finger flexion the test is negative, and then see if it's positive with the fingers flexed.